For the House majority here in Hawaii, we are focused on addressing the pandemic and public health concerns we continue to face, dealing responsibly with the state's tremendous budget shortfall, and positioning our state for a sustainable future as we navigate the waters of economic recovery. An issue that has been on almost everybody's minds is that of vaccines, and vaccines. So the rollout and whether you qualify, and to answer all of those questions you have, today I am joined by Eddie Mersereau, Deputy Director of the Behavioral Health Administration for the Department of Health. Eddie, you are the last executive department guest on season 1's last episode, and now you are the first guest on the second season. It's so fitting. To the viewers here, Eddie and his team have been responsible for the quarantine and isolation efforts that have helped our state deal effectively with clusters and providing services to those in need due to COVID-19. This team is now very involved in helping our state's efforts to vaccinate Hawaii's people. Eddie, can you paint for me a picture of who is involved in the statewide effort to vaccinate the people of Hawaii?
Thank you, Majority Leader. Honored to be here. Thanks for having me. So the vaccination effort consists of over 45 organizational partners across the state. They're all involved with our vaccination effort. And that's actually why we've been able to administer over 94,000 vaccinations across the state. And in just around 4 weeks, we started getting vaccinations mid-December. And so the partners include folks like all the hospitals in the state, the healthcare centers, the hospital systems, district health officers for each of the counties, and then also really small, but very committed groups like independent pharmacies, Times or 5 Minute, for example, and then some of our Department of Health teams, like you mentioned, that are working on the pod that we're doing in Windward, the Adult Mental Health Division.
So Eddie, you've mentioned it already, and maybe if we could pull up that new graphic. The Department of Health is going to start telling us on a weekly basis, is it, that how many people have been vaccinated? So what is the goal of this effort? And again, can you emphasize what was today's numbers for the administration of vaccines?
Yeah, so today's number as of this morning was 94,003 vaccinations, and we posted that this morning on our social media, and we'll continue to we're going to start posting that every day on our social media, except on weekends. And those are the we want folks to know the numbers that we're doing. I think sometimes there's a lot of confusion around the numbers that are being done versus the numbers that are coming into the state. So we want to make sure that people are informed and understand that there is a lot of effort going into the vaccination process. We're doing a very steady kind of strategic rollout of the vaccination because we have limited vaccines. But we want to make sure that we get those out and let people know what those numbers are.
And so we'll see those numbers hopefully tick up, but what is the expected time frame and what is the expected goal, again, of who you want to vaccinate?
Well, I'll tell you what, if the federal government gave us, 1.5 million vaccines delivered to us tomorrow, I think we would probably be done by summer in terms of vaccinating the majority of the population of those that want a vaccine. The goal is to vaccinate the entire population of the state. Everybody who wants a vaccination, the goal is to get them a vaccination. And I think if we continue to get the vaccinations at the rate that we're getting them, it may be a little bit longer than that, but we'll continue to move as quickly as we can.
And I really like that goal that you have. You want to vaccinate everyone in the state who wants to be vaccinated. And right now, the numbers look pretty tremendous that people want to be vaccinated.
Yeah, that's right, Majority Leader. So initially, as was the case across the United States, we were very worried that there was going to be a low uptake of people who wanted to get the vaccine initially. We were, some of the numbers that were being thrown around were 30 to 40% of the population were going to be wanting to come get a vaccine. What's really great is that we've seen the opposite. So we were worried that we were going to have more supply than demand. A good thing is that the opposite has happened, is we have much more demand than supply right now, which is it's actually a good problem for us to have. And so we're excited about the fact that the kind of community of Hawaii really wants to get vaccinated and do their part to really kind of get us through this pandemic.
And who is being vaccinated? We hear a lot about these tiers or phases. Who's being vaccinated now?
So we're primarily in phase 1A and phase 1B, which a lot of people kind of have different understandings of what that means. But really, in a nutshell, it's 1A are all of the health workers, the people that are on the front lines with this pandemic, people in the hospitals, nurses, doctors, etc. And 1B are folks like first responders, EMS, fire, police, and other kind of essential medical workers that may not be doctors or nurses and may not be working in a hospital, but may be working in community clinics and the like. And then most importantly, in 1B is our kupuna, who are over 75, which is over the next week or so going to be our focus primarily. We're going to be doing a big push to vaccinate folks that are 75 and older.
So now let's get back to Eddie to talk a little bit more about these pods around the state. So welcome back, Eddie. In addition to the pods at hospitals like Castle, Hilo Medical Center on the Big Island, Maui Health, tell me about your team's efforts at even more localized pods, or even some of these pods on the neighbor islands.
Yeah, thank you. So we also have a pod, which is a point of distribution site at Windward Community Health Center, which we started before Christmas, where we vaccinated about 1,000 people with Pfizer, the Pfizer vaccination. We're at this point, we've gone every week since then, and at this point, we're doing pretty steadily 1,000 to 1,200 doses per day. And we're operating about 2 days a week. And we'll be continuing to do that for the next 4 weeks at least, which will start to go into second doses after we've done the initial doses. Some of the other pods that are operating as well, there are pods like for Chair Yamane is involved in a point of distribution site at Leeward Community College that has vaccinated over 6,000 people in the times that they've been operating as well. And then we have a lot of mobile pods that we're really excited about to work with, for example, the small pharmacies who are going out to kind of the adult residential care homes or community foster homes where some of our most fragile kupuna and other residents are, because they're not going to be able to come to those pods. So we're going to try to bring the vaccination to them. And then obviously we have on all of the neighbor islands, we have similar efforts going on. For example, in Kauai, the district health office is running a really efficient, effective pod there. And same thing on the Big Island and on Maui. And again, the goal is to really have as many choices of vaccination and increase the access to vaccination. You know, the pods that operate or that have been talked about a lot in the media, like the Pier 1, the Pier 2, and the Blaisdell Center, those are extremely important for us to have those, but they're just part of the overall bigger picture and overall kind of components of the vaccination system and the vaccination plan that we're doing.
So I heard you talk about really helping those who cannot maybe get out of their homes, people in congregate settings. It raises the issue and the question of what about these other difficult to reach populations, like the homeless population, the prison population, maybe folks in mental substance abuse treatment homes. Will there also be pods that are going to those very high risk areas?
Yeah, excellent question, and thank you for that. And as the Deputy Director for Behavioral Health, it's a very important focus for me. And there actually are pods going to some of those areas already. What we're doing primarily is we're focusing on the staffing of those facilities and programs and institutions. And the reason why we're doing that is because, again, similar to why we're vaccinating first responders and similar to why we're vaccinating medical care professionals, if the staff go down of those different facilities and programs, then the whole service goes down. Right, like for example, if all of the doctors got sick, then we wouldn't be able to care for the people that are sick. Same thing with homeless programs and behavioral health programs, et cetera, and also the prisons. So the strategic approach is very, very strategic and systematic, is to do what we can to vaccinate the staff of those programs, frontline essential workers, essential responders, and get those guys taken care of first. And then we can start to, as we get more vaccine, we can start to expand out to the folks that are the residents.
And you've already kind of spoken about it, about the benefit of these DOH-led pods is that it provides for geographic diversity. There's a sense there maybe our communities being ignored, but can you speak to that as to how is that a benefit of the pods that you are doing, that you're covering geographically large regions?
Well, I think that's exactly the purpose, is so that we can get to all of the corners of the state, basically. And if have as many opportunities for people to go to a pod if they can, and then if they can't, we figure out ways to get the vaccination to them. And so that's why it's a multi-tiered, multi-leveled approach. And really, people talk about just the point of distribution, but we're also doing those standing pods. But again, we're doing the mobile vaccinations. We're going into the long-term care facilities. We're going into the small care facilities. We're going into the programs and other spaces where people have to congregate and have to be together and have difficulty physical distancing. And we're focusing on getting those guys taken care of first. And the reality is that as we continue to do that, more and more people will have access. There'll be more and more ability for people to get vaccinated. We've actually even started to do some house calls in partnership with our small pharmacies. We have at least 4 instances where we had some kupuna that were either extremely old and frail, or just unable to get out of the house to come get vaccinated. We had one who was 101 years old, and we went to their house and vaccinated that individual, and some other over 75 household members. So we're really excited about that. We feel really blessed to have the partnerships that we have to be able to make that happen.
So I want to talk a little bit about this because I hear a focus on the elderly kapuna, the 75-plus-year-olds. But then I know that on Kauai, and then at Windward, Oahu, there were reports of teachers becoming already in line to get vaccinated. And I think that's really important, that teachers are part of that 1B group and that they are, in fact, being assisted at these pods now. So we really are kind of starting to expand, right, depending upon the availability of vaccine on an island and the capacity at a pod for that given whatever population has signed up. Is that a correct way to describe what's happening? And so why there might be different, it feels like there's sometimes different people being serviced or versus others?
Yeah, so it's a really good point. So the goal is to get, again, everybody who wants a vaccination vaccinated in the state. We obviously, because of the limitation of the vaccines that we obviously have to be deliberate and systematic about how we do that. And so that's why we have those prioritization groups. But if you look at all of the folks that would technically fall into the 1B prioritization group, that's at least 200,000 people, because it includes teachers, it includes our kapuna, it includes a lot of grocery store workers, for example. And so we don't want to halt the kind of forward movement of vaccination by being really strict about who we vaccinate in each kind of category and each subcategory in 1B. So you're going to see overlap. Obviously, we're going to start, we're going to continue to start to, as we start to get through some pieces of 1B, we're going to start to do other pieces of 1B, and so on and so on. Again, it's all dependent on the vaccination inventory that we have. We here at DOH, we have daily meetings to review the inventory and look at where those are going, where those vaccinations are going, and how we can prioritize them so that we can get them out to the most important people that need them.
So we focus on a lot about who can get the vaccines and kind of the different phases. But what I'd like to talk about now is who works at these pods. Who are these like heroes? Now there are heroes. They're getting us these vaccines in arms. Who are these people working at these pods?
They are heroes. They're people who suit up and show up and get it done. And they're from all walks of life in all different places. Cherry Amani, for example, is somebody who is volunteered at the pod to do stuff. You know, it's not to understand the point of distribution. It's not just those folks that are putting the vaccinations, you know, doing shots in arms. That's technically the easy part. The harder part is registering people, making sure you have, you know, kind of flow management. There's medical observations, that kind of stuff. So we have people from the medical profession. We have volunteers from different groups. We have a lot of people from the Department of Health that are doing that on top of their everyday, you know, kind of day job. So we've got a lot of folks that are involved. And again, it's an all hands on deck effort, and we appreciate everybody that comes and gets involved in it.
Thank you, Eddie, for sharing with us some of those details about the people, the volunteers who are showing up and being part of the process, and the state employees, our state workers who are making sure these pods happen.